everyone, my name is Mackenzie Dankert, and I chose interprofessional collaboration as my concept of leadership for my paper in my PowerPoint today. So the whole reason for interprofessional collaboration is to deliver patient care. And patient care is an all-encompassing service. It involves medical, psychological, and social care, along with health promotion and illness prevention strategies that all require a variety of professionals and skills in a team-like approach. There are several studies that are out there that are supporting interprofessional collaboration and communication. And the overall goal of it is to, of course, provide patient safety and quality of care that's cost-effective and accessible. And some of those studies showed that poor communication between different disciplines was associated with increased mortality, increased length of stays, and increased readmission rates of patients. So communication is a big key in interprofessional collaboration. That's why some of the key components is, number one, is team communication, leadership, which is what we'll be focusing on in this PowerPoint, coordination, and also decision making. So leadership is one of the big key components that we're going to focus on when talking about interprofessional collaboration. And leadership is not discipline specific, but it is essential to being an effective leader, which we've learned. And just some supporting articles from the Institute of Medicine that are just supporting interprofessional collaboration. The first one is from an article called "To Err is Human," and this one is just reinforcing the need for interprofessional teams to focus on communication and collaboration in order to provide patient safety and quality of care. And then the other report is "The Future of Nursing," and this one recommends that interprofessional collaboration is used to ensure coordinated and improved patient-centered care. And this should be done by partnering as a team with other disciplines and specifically taking on lead roles. And in interprofessional collaboration, each discipline, so the doctors, the physical therapists, the nurse practitioners, the dietitians, pharmacy, all of these different disciplines all contribute uniquely depending on their scope of practice, and each bring separate and shared knowledge and skills that, when are brought together, allow them to influence patient care with that common goal of patient safety and the quality of care that they can all deliver. And unlike some traditional models of leadership that are more hierarchical in nature, interprofessional leadership is more focused on participatory leadership that is horizontal, relational, and situational. And then leadership and interprofessional collaboration are enhanced with the knowledge and skill set of these three main things that I talk about in my paper: emotional intelligence, self-reflection, and shared leadership. So the first skill that I'm going to discuss that is a part of successful interprofessional leadership is emotional intelligence. I found that leaders that show high levels of this are able to influence how individuals on the team follow direction, interact, and cope during stress. And also trust in leadership, relationship building, promoting teamwork, and conflict resolution all stem from emotional intelligence. These skills allow leaders to be able to identify a situation and adjust their style accordingly we know that the healthcare environment is always changing. So they'll adjust their style, and this allows them to optimize their team's abilities to perform their best and to create positive outcomes overall. The second part of successful interprofessional leadership that we're going to discuss is reflective practice. And this is the ability to analyze actions and experiences with the outcome of developing practice and enhancing clinical knowledge. This is beneficial to leaders because it improves their critical thinking, it optimizes empowerment, it provides greater self-awareness, and increases personal and professional growth, which all in turn benefit the patient by improving quality of care and outcomes. It also encompasses the skill of active listening, which is critical in communication with interprofessional leadership and collaboration. It allows for a deeper engagement with others. A registered nurse leader with experience in direct care and formal leadership roles did an interview with the Canadian Nurse, and when they asked him what the best piece of career advice he had received was, his answer was listen to learn and learn to listen, really focusing on that active listening component. The last component that I'm going to discuss is shared leadership. Interprofessional leadership has been described as a shared leadership. This occurs when there's a change in the leader within an interprofessional team, and this is usually based on the patient's needs and care. For instance, in a situation where a patient's medical needs are stable and uncomplicated, but their emotional or social needs need to be addressed, then leadership of the interprofessional team would transfer from medicine to social work or mental health services. Basically, each member of the team ultimately is going to transition back and forth between roles and relationships with patients in the team, and it's important to know when it's necessary to be the leader, the collaborator, or sometimes even just the follower. In a study that was performed by Ananson and his colleagues, participants were found to have this unanimous belief that the most successful patient outcomes came from effective interprofessional team-based practice, and the participants also believed that team leadership was a shared responsibility of the team together. These authors of this study suggested that the goal of collaborative health care teams should ultimately be commitment to a patient outcome in lieu of their own discipline and their own outcomes. And active listening, trust, relationship building, emotional intelligence, and self-reflection and practice are all key elements that help strengthen a leader, all while understanding a patient's needs and what each discipline brings to the table and to offer patients. Advanced practice nurses are definitely in a position to lead within interprofessional teams because of the skills that they have. We know that nurses spend the majority of time delivering patient care, but this provides valuable insights and abilities that contribute to better the quality and safety of patient care. Advanced practice nurses are educated on how to assess the needs of patients and families and gather data on quality indicators and also embrace leadership roles. They have expertise that come from education and legal authority in both medicine and nursing. So nurse practitioners are known to enhance collaboration and communication and promote interprofessional care delivery. I included this study done by Herlock, Chorostecki, and other authors. They did a study that explored healthcare professionals' perspectives of the strategy that nurse practitioners that they work with use to promote interprofessional care within hospitals and long-term care facilities. So basically, they just interviewed professional colleagues that were regularly working with nurse practitioners. Overall, the study found that valued nurse practitioner role attributes in delivering interprofessional care consisted of consistency, patient-focused care, effective communication, and being a respectful central role. An occupational therapist described the nurse practitioner role as one consistent person on the unit from the start of the morning to kind of the end of the day that is available to answer questions, provide orders, to service the needs of patients. And there was a physician that commented that on a daily basis, the nurse practitioner coordinates all the other colleagues' participation in the care of patients, and that nurse practitioners were viewed as the go-to person for medical questions when a physician was not available. The participants also really focused on the communication skills of the nurse practitioners, and they described their communication as frequent, respectful, and that it encouraged shared decision making. A pharmacist had stated that we tend to know more about our patient and more about the plan because when an NP is involved, they're more involved with the team. Overall, seemed like the participants liked the nurse practitioner being around. They were highly valued and pretty much deemed necessary to facilitate strategies of collaborative interactions, create cohesive working and partnerships among healthcare professionals, and ultimately enhance interprofessional care. Advanced practice nurses are expected to demonstrate leadership qualities at an advanced level in their role. However, many healthcare organization decision makers like managers, senior administrators, physicians, they have a lack of knowledge about the leadership capabilities that these practitioners bring to the table, and unfortunately this withholds use of their full scope of their role, and it further limits the potential impact that they can make on patient care and the health system overall. A nurse practitioner and author, Julie Waldrop, wrote an editorial, and she determined that there is still a culture within both the educational and healthcare system that creates difficulty for nurses to lead. And the legal authority of nurse practitioners to be able to practice is governed by state law, so it differs from state to state. Some practitioners are allowed to practice independent of physicians, but unfortunately others are restricted by required physician supervision. In that study that I talked about earlier by Herlock, Torostecki, and his colleagues, physician participants commented that they had a role as the leader and that others basically followed their orders. And some of the other healthcare professionals noted a nursing medicine hierarchical relationship between nurse practitioners and physicians, that the nurse practitioners were recognized as being structurally below the physician. One interviewed nurse said that, "I don't believe that our doctors are utilizing NPs to their full potential." And I also did a personal interview with a nurse practitioner that I'm friends with, and we kind of discussed this limitation that nurse practitioners kind of have going against them. And she stated that the term mid-level provider that's commonly designated to them, she finds it to be pretty problematic because it conveys a hierarchy and a level of care underneath the physician. She said that if the goal is to have a successful collaboration between nurse practitioners and physicians, then they have to be treated as an equal. And she believes that physicians definitely set the tone for building a strong multidisciplinary team. So overall, these hierarchical relationships create collaboration challenges and barriers within the interprofessional team, and they interfere with the ability to provide effective care. There is an increasing amount of evidence that report the participation of nurse practitioners in interprofessional teams brings optimal care. And unfortunately, the abilities of them are not fully understood by some individuals, and therefore their potential benefits to patients and the healthcare system can be wasted. Regardless, the Institute of Medicine, one of their articles, The Future of Nursing, experts still suggest that nurse practitioners practice and take on leadership roles within these teams to their fullest extent of their education and training. And in the current state of healthcare, that is continuously changing, there is a demand for leaders at all levels of the interprofessional team, just to lead changes that will create positive results overall. And just to sum everything up, healthcare is unpredictable and dynamic. It's constantly changing for a multitude of different reasons, but it requires healthcare professionals to bring forth effective leadership. There's been a number of studies that suggest the use of effective interprofessional collaboration in order to enhance the quality, safety, and accessibility to care. And leadership and interprofessional collaboration are enhanced with the knowledge and skill set of emotional intelligence, self-reflection, and shared leadership, like we talked about earlier. And nurse practitioners are effective collaborators within the interprofessional teams, and they possess many of the skills that are necessary to lead. However, unfortunately, some traditional hierarchical healthcare relationships bring a barrier to their delivery of interprofessional care. But overall, as the data suggests, the best way to ensure consistent positive outcomes for patients is through interprofessional collaboration and leadership. Thank you guys for listening.